Hello and welcome to Going Back to School During COVID-19, an Answers for Families webinar brought to you by Boston Children's. I'm Karen Wright and I'm the Director of Content at Boston Children's, and I'll be your moderator for today. As a mother of two myself, I'm not surprised that this theme has had a lot of interest. Returning to school is always a big topic, but last year and this year, there have been many more questions and concerns than usual, and that's why we're here today. Before we get started, I'd like to touch on some quick housekeeping items. First, this webinar is live on Facebook, and it's also being recorded, so it will be made available for you to watch again in the future. I'd like to let you know that right up front in case you're like me and tend to take a bunch of notes. Next, we expect you will have a lot of questions, and many were sent to us in advance as well. So please know that we've allotted time at the end for them. In the meantime, if you have a question, please type it into the Q&A box below. Finally, please remember that if we don't get to your question today, we do have a lot of sources of information beyond this webinar, including our Answers Content Hub and our various social media channels. We'll also share our COVID hotline number at the end of the hour. So let's dig in. We're very happy today to have two heavy hitter experts to help guide today's discussion. I'd like each of you to take a moment to please introduce yourselves. Let's start with you, Dr. Moffitt.
Sure. Yeah, thank you so much for having me here today. I'm happy to be here to walk through where we are currently at with the COVID-19 pandemic and what that means for our kids going back to school. I am an infectious diseases physician here at Boston Children's Hospital, so I see patients. I also do a fair amount of research here, including some COVID-related research. I also am a mother of two children, a middle school age child and a high schooler. So can certainly relate to many of the questions and concerns that parents have right now in thinking about keeping our kids safe as they head back to school.
And Dr. Lee?
Hi, everyone. I'm Dr. Erica Lee, thrilled to be here with you all. Excited to hear some of your questions. I'm a psychologist here in our outpatient psychiatry service at Boston Children's Hospital, and I do a little bit of everything. So I see a fair number of patients and families. I do a lot of teaching and education, and I also do some research. So thrilled to be here and looking forward to it.
Great. Thank you both, and thank you for taking your time to join us again today. Let's get started. Why don't we start with, where do we stand now with COVID? Dr. Moffitt?
Sure. So I think it's fair to say that currently where we stand with this pandemic is in a position, I'm going to compare it to this time last year, where we know a lot more both about this infection, both about the virus and how it causes infection. We've learned a lot about which individuals seem to be the most susceptible to severe infection. But all of that being said, I will say there's still a lot that we are learning about this virus. We're learning new things literally every day about COVID-19 and its ability to cause infection and its impact in having some longer term effects as well. We're learning every day about immunity to COVID-19 infection, including the immunity that we get from having been infected, and of course, the immunity that we get from the vaccines that are available. I would also just say that we had an unbelievable advantage in learning last year from the variable combinations of ways that children were going to school, about what kinds of protocols were effective at keeping children and staff safe in schools and keeping transmission in the school setting really relatively low, especially low compared to community-wide transmission. So we can move forward into this coming school year and bring that knowledge with us because of course it's relevant again in the current state of the COVID-19 pandemic, given the surges that we are currently seeing in our country and elsewhere, largely driven by the Delta variant. So we can talk about that some more as well.
So in talking about the Delta variant, are there any specific special ways to keep people safe with this strain, or is it more of the same?
Well, I think if we start by talking about what we do know about the Delta variant that makes it different than other variants, we know that it's about twice as infectious as previous strains. We also know that the Delta variant is causing nearly all of the current infections that are being tracked and sequenced here in the US. The data on whether or not the Delta variant in and of itself causes more severe infection really are still a bit early and have been a bit conflicting. There were recent studies that suggested a higher risk of hospitalization in those who are unvaccinated should they become infected with the Delta variant compared to prior variants. But there are a lot of variables at play here, and this really, frankly, still needs to be better evaluated. We do know from the Delta variant that infection seems to be associated with higher viral loads. And this is likely contributing to the increased infectivity that we know the Delta variant is capable of. But importantly, now that we have vaccines, we are learning all the time that they continue to be very effective at reducing the likelihood of becoming infected and the likelihood of infecting others, though we know that breakthrough cases are occurring. Estimates right now suggest that anywhere from maybe a quarter to a third of the cases due to the Delta variant may be occurring in vaccinated individuals. Again, there's a lot of variables at play in determining that number, but those are current estimates. But importantly, we are learning in many different settings that the vaccines maintain excellent effectiveness at preventing severe infection, hospitalization, and death due to COVID-19. And this is demonstrated in the finding that over 90% of those hospitalized with COVID-19 are unvaccinated. And that also explains the surges that we're seeing in hospitalizations in regions with low vaccination rates. In terms of the effect that we've been hearing a lot about, especially in the last week or two, of COVID-19 infection on children, there are some regions reporting increased rates of pediatric hospitalizations. And again, this is not clearly because the Delta strain makes children sicker than previous SARS-CoV-2 strains, but it really comes down to numbers at this point. Children under 12 are not yet eligible for vaccination, and many adolescents who are eligible for vaccination have not yet been vaccinated. So those individuals who remain susceptible to severe disease, given the vaccine availability or lack of vaccination, make up a larger proportion of the population that's susceptible to severe disease. So that is most likely the biggest factor driving those numbers in terms of increased pediatric hospitalizations that are being seen in some parts of the country, again, not in all parts of the country. So thinking then about ways to stay safe, particularly in the setting of Delta strain infection, we really, again, can rely on what we learned from the surges that were occurring last summer when we had a lot to learn about COVID-19 infection. We learned more about how to stay safe in schools during the surges that happened through largely through the winter of this past year. What that showed us was that masking indoors, increased ventilation in indoor settings, and distancing, really those measures combined are very effective at reducing transmission. And there's no virologic reason, there's nothing that's understood yet about the Delta variant per se to lead us to believe that this would not also be effective against the Delta strain. I would also just say, in terms of staying safe, that individuals and families should have a lower threshold for testing for SARS-CoV-2. Tests are far more available and accessible now than they were this time last year. I would say that if families have the opportunity to participate in school testing programs, if these are offered, then they should. And this is largely because infections in children and infections in vaccinated individuals are more likely to be mild and maybe even asymptomatic. So families and individuals should have a very low threshold for staying home if anyone were to develop symptoms and getting a test, even if these are mild symptoms and even if they are symptoms that may just be due to the common cold. It would be very difficult at this stage to distinguish symptoms of the common cold from a COVID-19 infection.
It's a lot of information there. So it certainly sounds like you're telling people to continue to get vaccinated, continue to do all the same protections. If you've gotten vaccinated, a breakthrough chance is possible, but that in all likelihood, it would be asymptomatic or a lot lower. You're not seeing a lot of people that have been vaccinated that then get severe disease. Is that fair?
That's correct.
Okay. And what do we know about under 12 and vaccination?
So the latest the latest updates really are coming from both Pfizer and Moderna, both of whom have trials underway in 5 to 11-year-olds. These trials are using lower doses of the vaccines than what have been used in the authorized and now approved vaccines so far. The FDA will be considering all of the data from this age bracket very carefully. They want at least several months of follow-up of safety data. But at the same time, with back to school, with the Delta surge, and with rises in pediatric infections because they remain unvaccinated, this is absolutely being considered on balance with the risk of leaving this population of children susceptible. So I think a realistic time frame for the earliest authorization and it would likely be the Pfizer vaccine to come first for those 12 and under, based on where they're at with their studies, would be maybe mid to late fall. Most recently, Pfizer has said that they expect completion of data in this age group for submission to the FDA by late September or early October. So at that point, the FDA would need to consider that data and make any sort of statements around authorization for that age group.
And what would you say when parents ask about getting and basically trying to sneak getting a vaccine for their younger child?
Yeah, no, it's a great question. It's understandable that parents would be eager to do everything they can to keep their child safe. It is critically important, though, that we wait until we have all of the available safety and effectiveness data in this age range. Again, the current vaccines the available vaccines are a different dose than those that are going to likely be moved forward in younger children. There were very careful dose finding studies that happened in these lower age groups to really land on a dose of the vaccine that still was able to lead to similar immune responses, but had favorable safety profiles in younger children. And those dose finding studies both ended up landing on lower doses than what's been used so far in those 12 and older. So really important that we put safety first and not move forward with using these vaccines in an unauthorized way.
It's a very, very important message there. Dr. Lee, and what would you do to suggest to parents how to talk to kids who are confused or frustrated with where we are right now with the updated protocols, with not being able to get vaccinated if they're younger, or debating it if they're older?
It's a great question, and it's an understandable one. I think we're all sort of sick of being in this space that we've been in for so long. It's a totally new way of life, and I think everyone's kind of tired of it, and it's of course very stressful. The number one thing I always tell parents is, take some time and just validate how your child is feeling, right? This is frustrating. We all wish this was over. Take some time and just empathize with your child or teenager. This is so hard to not know when this is going to end, to have to keep doing all of these things. And to Dr. Moffitt's very good points, this is the pathway to getting us back to quote unquote normal, right? We know, especially from the data from last year that Dr. Moffitt was talking about, that, the way to keep people safe is to follow all of these recommended safety protocols. This is the most effective way to keep ourselves safe, to keep other people safe. We have some data about how that looked like in schools last year. And so this is a good reminder that, the better we take care of each other and ourselves, the faster we'll get back to where we want to be. And another thing that I recommend that parents do is to try to focus on what we can control versus what we can't. It's very, very frustrating and anxiety provoking for all human beings to have all of this uncertainty, to not be able to control things like, what the safety protocols are, what activities we can do, et cetera. And, doing something like wearing a mask, washing your hands, appropriately kind of keeping distance when you can. Maybe this means that you're able to get to go to school, see your teacher live, see your friends, and also play sports. So taking the time too to kind of reframe, there's so much that we can't control, but when we focus on that, it feels completely overwhelming. What can we control? And how can that actually help us move towards our goals in a way that feels productive, so we can see the benefits of being able to go back out and do things in our everyday lives?
So in focusing on that control, what are some thoughts on how to talk to your kids about keeping their mask on and why it's important? I know with my kids, they say, I'm vaccinated, and if it's optional, I'm not doing it. Shocker, teenagers would say that. But as a mom, I'd love advice from you on what to say. And with younger kids too, there are different challenges depending on how old the kids are.
100%. But I agree with you. I think especially teenagers, I get it. And, they're in the developmental stage where they're sort of exerting more of independence. And I think it does need to be a collaborative conversation. But I think sitting down and having that conversation with your kids, whether they're younger or they're older, is really valuable. Like, let me hear your perspective. I want to take time rather than just saying, you have to do this thing, even if they have to do this thing. Let's have a conversation about it. What are your concerns? Why is it feeling difficult for you? Like, for example, one thing I'm hearing from a lot of teenagers now is, well, my friends aren't doing it, or their friends don't care as much. So now I'm sort of, there's this peer pressure to sort of, do what everyone else is doing. And so you can kind of do role plays with your kids, is walk through, like, why is this important specifically for our family? Every family is making different safety decisions based on what they know works best for them, and also the different ways in which families have different risk profiles. So what works best for our family, and what are you kind of saying as parents needs to be the rule for your kids in order to keep them safe, to keep your family safe, et cetera. And then let's role play it, right? So I kind of do this sometimes when I'm seeing kids for therapy. It's like, let's role play. Like, if you're at school and everyone's like, hey, we don't have to wear masks anymore. Why are you still wearing one? And kids are like, well, I actually kind of want to wear one and I feel safer wearing one, but now I feel embarrassed saying so. It's like, let's role play how you might say something back and be like, yeah, I just feel better this way, and not make a thing and sort of move on, right? But sort of talking through that sort of stuff with your kids can be very helpful, because then they have a model for what they're going to do when they approach that situation. And then you've also had some time to walk through with them. Maybe they have misconceptions, right? Kids, just like adults, are getting news and information from who knows where these days. There's so many sources of information. And your understanding might be like, well, actually, the CDC says this, or our expert, Dr. Moffitt, says this. And your kids might have a different understanding that they've heard from their friends or social media or any number of other places. So take some time too to just talk with them about what are their concerns, why are they wanting or not wanting to do something. So you can come up with a collaborative plan, and then it gives you the opportunity to say, no, these are actually the hard scientific facts, and this is what we need to do, and how can we get you to do it? And then going back to what, Dr. Moffitt and I have been saying, the number one way out of this is this is a huge collective effort, which is so complicated because there's millions of us. But the more that we can band together to follow these established safety protocols that are backed by science, the faster we're going to get out of this. And that requires every single one of us doing our part. And so, helping your kids kind of see, you want to go back to your regular life where this is easy. We don't even need to think about wearing masks or distancing. This is the way to do it.
Sort of related, again, tied to my own personal life. How important is it for, you talk about identity with children, and how important is it that they have a mask that they're comfortable in, and that they, I had somebody say to me yesterday, they wanted me to buy them a $15 Under Armour mask. How important, now I'm not saying everybody should go do that, but how important is it to have a little bit more leeway with what they wear if they'll actually wear it? Sort of like a bike helmet. We'll get you whatever one you want if you put it on your head.
I love this question. That's a great point, right? I think that within, obviously, some people are able to buy kind of fun, fancy masks, and the people are not. So within your family's means, I absolutely think it's great to think about that. Of course, you want it to be safe, right? So you want to make sure it's not just like some sort of novelty item that, has a cool sports team on it, but maybe is not providing the protection that you're hoping. But I absolutely think that's a great idea. It's like, be collaborative. And especially younger kids are loving that, because they get to pick a mask that they're excited about. Maybe it has a superhero on it. Maybe, that could also be part of like, you're giving yourself superhero powers when you wear your masks, but definitely for older kids and teens as well, is that can be part of the collaborative. Okay, you don't have a choice of whether you wear a mask, but I'm going to give you these choices and you can pick which one you want. That's still giving them some agency and some control, even if they're not wanting to wear a mask and that part's not a choice.
And I would say when it comes to the effectiveness of the mask, the most effective mask is the one that a child or a teenager will wear. And one that they will keep on. And then beyond that, the most effective mask is one that fits them well, and one that is made of at least 2, if not 3 layers. So there are so many questions about studies and what have they shown when it's a cloth mask versus a medical grade mask versus an N95. I would say that first, for children, if anyone has ever worn an N95 for a long period of time, it is incredibly, incredibly difficult to do that. They have to be appropriately fitted. And then there are the sort of lower grade N95s or the KN95s that are available. If your child can wear one of those, or more likely a teenager, because they're not often made to fit smaller faces, if they can wear one of those and are comfortable doing so, that's fine. But more important is that your child is equipped with a mask and at least one replacement mask that is something clothing that he or she is most likely to wear and be comfortable keeping on for the duration of their time indoors.
And speaking of time indoors, I think you both have children, right? I apologize that I don't recall that. Are your kids going to school or daycare or what have you this fall? We've definitely had some parents say, you know, I'm still too scared, I'm keeping them out. And which is additionally challenging this year. We know that the state has said, or at least in Massachusetts, no, you have to get your kids into school now. We're not doing remote. So what are you two doing?
Yeah, as I said, I have a middle schooler and a high school age student, and they are both going to be in school full time on that first day of school. There is not a remote learning option, and frankly, I think even if there had been one, we would have gone forward with in-person learning, and that really comes from their experience last year and how much they missed being in person in school, not just socially, which was huge for them to miss out on the social interactions and the development that they experienced from being in person with their friends. But additionally, academically, we learned a lot about what works and doesn't work for our kids in terms of how they learn last year. And they both benefit substantially from the in-person interactions that they get to have with teachers and staff. So we're really excited for them to be able to be in person. They're excited to be in person. And we are going to do everything that it takes to keep them as safe as possible in that setting.
I'm not a mom yet, but I'd like to be one day. And I work obviously with lots of kids, and I've got lots of nieces and nephews where we're working through these exact issues. And I love, Kristy, that you brought up, you know, that we've learned so much about what helps kids learn and also what doesn't work as well. I think actually one of the upsides that's come out in the more recent research, psychological research on how kids did in school last year is, yes, in person works for most kids, but there are also some kids who are actually doing some of that remote learning and having a little bit more independence in the way that they learn, and the flexibility worked really well for them. So I think one of the sort of silver linings that's come out of this awful experience that we've all been through with the pandemic is that we learned a lot more about alternative ways of teaching kids and really figuring out how to customize the educational experience, and of course also keeping kids safe.
Well, it's good to get some good positive learning out of it. What about kids that are, hopefully most kids are very involved in school. Maybe they're like my kids and are in there doing athletics, or they're theater kids or robotics kids. What do parents need to know about kids going back with fall sports and activities?
In terms of the safety of those activities, really, I think we, for example, are getting really excellent direction from our school district in terms of what the expectations are going to be and what the expected protocols are going to be. I would recommend for any family that for whom that's not been made clear, it is absolutely appropriate to reach out to your school district and ask for clarification. I think a lot of school districts have really been putting a ton of time and effort into communicating that. In terms of the protocols that we now have very good in real life experience with and data around that show that they're effective for indoor activities, it's really those layered measures that have been very effective at keeping transmission low. And those layered measures include masking, include improved ventilation, and include keeping distance to whatever extent is possible. You know, brief interactions that breach that minimum 3 feet of distance are probably not substantially as risky as really being kind of head to head with someone for a prolonged period of time. So beyond that, outdoors continues to be a safer environment in terms of COVID-19 transmission reduction. I think that if people are going to be able to be outdoors and be separated and keep a fair amount of distance, that masking is not necessarily going to add that much to the risk reduction, but people need to keep in mind and be flexible for a possible change in that recommendation. And that's going to be especially true for outdoor activities where keeping distance may not be all that feasible. But those are really going to be the basic measures moving forward. Not sharing any sort of drinking devices, everyone bringing their own water bottle, for example, hopefully with opportunities for water filling stations to be available, reminding kids about hand hygiene, and really just everybody maybe having that discussion almost on a daily basis of the sort of 1, 2s, and 3s of what's going to keep us safe. And even if you're getting eye rolls from your kids, which I've seen plenty of lately because they're tired of hearing it, I still feel like it's good to just kind of revisit it. And that keeps you well prepared for an opportunity to talk about when things do change. They're not hearing about things out of the blue. They're hearing about things that are changes from maybe what they were doing last week. And that, as Dr. Lee had described, really gives an opportunity to discuss why those changes are being recommended and to have a really open discussion around that.
Just to connect for what you said a moment ago about reminders, we all say wash your hands, use a mask, keep your distance. But I don't think it gets driven home enough when to switch your mask. And you mentioned earlier bringing a mask and a spare. When do you need to take that mask off and put a different one on?
Yeah, no, that's a great question. If the mask has become wet or damp, it's time to remove that mask, wash your hands, put a new mask on, and wash your hands again. That would really be the main one. Or at any point, certainly if it's one of the medical grade masks, if it's got a tear in it, a hole in it, anything like that. If it's the one with the sort of metal adjustable nose piece, and that no longer is adjusting very well, allowing the mask to fit very well. So anything that has either made the mask damp or wet, or has otherwise kind of breached the structure of the mask, in either as a tear or something that makes it not fit very well, those would all be indicators that it's time to change the mask.
Great, thank you. So moving from the mechanics to the emotions, Dr. Lee, since so many kids were home a long time, hopefully some made it to school in some version last year, but it's a whole new world. How do you help your child with just the emotions of going back and dealing with being away from you or away from home or away from their dog, and just, which is a big deal. I've seen a lot of pictures of sad dogs of kids back at school. How do you help children through this next couple of months in particular?
It's a great question. I think we're all, we had this thing where we all suddenly had to be together all the time, which is very overwhelming in a different way. And now that we have to separate, that's also hard. And I'm glad you brought up the pets, because I think that I've been hearing this left and right from families and colleagues that there are so many animals that are having separation anxiety because they've gotten to be used to their being around their family all the time. So again, starting with just validating, this is hard. You understand how hard this is, and this is going to be an adjustment period. I think, as you said at the top of the hour, going back to school is always kind of a stressful period where people are having a hard time adjusting to having had so much fun over the summer, getting back into the routine, the structure, separation, et cetera. So this is that plus a little bit of extra. So kind of going over, okay, what is our plan going to be? And for some kids, especially the kids who are really nervous about separating, you might want to give a little bit more of a runway. So I know many of our schools are going back in next week. So taking some time over the next few days where we're going to, maybe we start a new routine where we're going to drive by the school. We're going to kind of remember what it's like, right? If there's an opportunity to even go in a little bit earlier, some schools are letting kids come in and just like see the classroom really quickly before, especially if this is their first time back into school or they actually haven't really been to formal schooling because of the pandemic. You might want to start reinstituting some of your morning routines, right? Because it's always hard for kids all of a sudden, it's school day and we have to have a whole new morning routine. So take some time where we pack your backpack, we pick out your clothes, we kind of sort through what we're going to do in the morning. We start moving your bedtime a little bit earlier, whatever you can to make sure you're getting a good calming night's rest. So you're easing into the school day will be very helpful. And then also you can make kind of a plan for, okay, let's remember what the school day is going to look like. So I know some families had to do this last year as well, when all of a sudden we've been doing remote learning and then some kids were able to go back into the school year towards the end. So kind of what is it going to look like, right? As best as you understand it, are students going to be distanced? Are they not? Do people have to wear masks? Kind of taking some time to anticipate what will the school day look like and what will be similar to what you remember from before and what might be different. Because that way kids have a concrete idea and it doesn't just feel like this big, uncertain, scary unknown. We have some idea, we're going to go in, this is how the day is going to go. Here are the things that maybe will be the same. These activities will be different. This is how you'll interact with your teacher, et cetera. And then remembering to remind kids, right? Like we've gone through so many challenges over this last year. So let's go over some times in the past when you've overcome some of the things that were hard for you. And what are the coping skills that you used to get through it last time? And what are you going to use this time? So we're coming up with like a little coping plan for what we're going to do. And when they're in the classroom, remind your kids they're not on their own, right? You're there to support them. Their teachers and school professionals are there to support them. So if you need some help during the day, either what's a coping skill you're going to do on your own, or who are you going to turn to so you've got some help. So again, it doesn't feel quite like, oh, I'm just going to get there and I'm not going to know what's happening. I've got a clear plan. This is what the morning looks like. This is what the day looks like. Here's who I'm going to go to for help. Here are some strategies I'm going to use to kind of get through the day. And then reminding them, you've done this before, right? Not this exact thing, maybe, because we're all living through this for the first time, but you've done hard things before. And let's remember that you're really strong and capable and you can be brave, and you're there to talk with them about it and sort through the concerns.
So if that's all with, thank you, with helping your child or your adolescent get prepared, if you have a child or an adolescent that in particular you feel like is very anxious or stressed, or maybe they have a history of anxiety or stress, is this something where you see there being an advantage to giving a heads up to, in younger kids, their teacher, and older kids, their guidance counselors? And then whether you do that or not, at what point later on do we say, okay, I need to reach back out again? What kind of communication in general should you be having with those teams?
Thank you for asking that. It's a great question. I encourage as much communication as possible. Not to say you should start overwhelming and calling your guidance counselors in schools every day, because we know this is such an anxiety-provoking time, and that's true for all families. And of course, our school staff are also under a lot of pressure to try to, support families and make the school year go as smoothly as possible. But I definitely encourage communication. That's what they're there for. They're there to support you. And the more that schools understand about, like, hey, just so you know, my daughter's a little bit nervous about going back to school because of this, or they're feeling a little hesitant around this, right? But that's actually very useful information for your school support staff to have, so that they can kind of keep an eye out of, like, okay, is there a way to make a plan where, like, the guidance counselor or the adjustment counselor, every day or every other day just does like a quick check-in, or letting the teacher know, like, hey, my child's going back to school. They're really feeling stressed about, learning in this way or getting back to in-person learning. What are some strategies that we could use? And let's make sure we're keeping open communication. So if the teacher's noticing anything in the classroom, that they're then letting you know. I mean, that's what they're there for, and they're very excited to do that. So I think giving that communication and that feedback to schools is really important. And then if for your second question, when do we kind of want to continue the conversation, is if you start to notice your child is having a harder time, right? So right now, I will say everyone's kind of anxious. So I said that the sort of baseline or average level of anxiety that people are feeling is definitely higher than normal during the pandemic. But if you start to notice significant changes in your child's behavior, right? So they're always in a low mood, or for kids and teenagers, often depression can look like crankiness, right? So they're really short-tempered or kind of annoyed all the time. They're just kind of blah. Right? So you're noticing that, but you're also noticing that, maybe they're avoiding things. So they were excited about certain activities or friends, and now they're not wanting to do that. They're isolating more. They're worrying all the time. And it sort of feels like they're on this merry-go-round and you just can't get them off. They just spiral. That might be some time to think about, like, okay, what is the school noticing, right? Is there a guidance counselor or adjustment counselor who might be able to check in with my child, every week or every other week? Do we want to talk to our pediatrician to see whether getting some more formal behavioral health support would be useful? So you do want to keep an eye out for some of those warning signs that it's a little bit more than just the usual sort of worry and stress, especially after we're into the school year for a few weeks and everyone has settled in.
Yeah, that certainly sounds like a difficult time to figure out getting through all of it. And what about, there could be some kids out there that actually are alternating, or maybe their parents switched them to be being taught at home. We know that there was, a shift in some cases over the past year and a half from public to private, or from public or private to homeschooling. People kind of learned a lot about what they could and could not do. What about kids like that, and any isolation or concern that they are going to be experiencing?
So I think it's a great question. I think the number one thing that helps is having some routine and predictability, which was very hard to maintain during the pandemic. Like Dr. Moffitt said, every day things are changing, we're learning new things, and we're always sort of waiting for, our schedule is going to change. What are we going to be allowed to do or not allowed to do, and in what way? So I think especially for those kids who might be alternating and doing some sort of hybrid schooling, where some of it might be at home remote and some of it's in person, set up a schedule, and you can make it visual, right? So you can write out the schedule of, like, here's where you are on these days and here's where you are at different times. You can post that, wherever they're going to be studying in the house. trying to have some structure around where it is that they are doing learning, especially if it's at home. And I know this isn't possible for everyone, right? One of the difficulties with having to do everything from home is we're all stuck in these like smaller spaces and don't necessarily have the luxury of having room from each other. But if you do, setting up sort of a dedicated corner that, is as free of distractions as possible, has the things that your child needs, whether that's water and some snacks, but also their school supplies, their schedule, a clock or a timer, and then also talking with your child about, okay, here are the times during the day where, depending on your own work schedule, we're able to check in, see how things are going. And if you need anything, here's the times where we're going to touch base. I think that can be very helpful because it's very confusing for kids. I'm always amazed that kids can even manage. They're like, it's day 1, it's day 8, or what, their schedules are always changing. And now that you're thinking about going back and forth between being at home and being at school, it can be very disorganizing. So the more sort of structure and routine that you have around that study time, the easier it is for kids to anticipate, okay, on Monday, Wednesday, and Friday, this is my flow of the day. On Tuesday and Thursday, this is what I'm doing. I think one of the advantages, it's so hard. I mean, here we are all on Zoom, it's been exhausting doing so much virtually. And it's also a huge gift because it allows us still to stay connected with, classmates and teachers, even if we're not physically in the classroom. And so, again, talking with your child's teacher or your child's school support staff around what your individual child needs in order to maximize their learning and make this as successful a year as possible, whether if they're doing some sort of hybrid.
Dr. Lee, you've talked a lot about the importance of consistency, and Dr. Moffitt, you've talked a lot about the protective things we all should be doing, us and our children, to keep them healthy and safe. What about the fact that the rules aren't consistent, right? You've got the rules for school, depending on the school system regarding masking. You've got whether gym is inside or outside, whether you're off going to rehearsal or practice, or you're in the car on the way there, or inside your bubble, outside of your bubble. I think we're all trying to drive home, be safe, be safe, be safe. But I think it's confusing, and particularly depending on the age of the child. So how do you handle that when a kid says, well, I'll put the mask on when I get in school, but when I carpool with Joe and Mike, I'm not worried about it. How do you instill in them, regardless of what the rules are, this is what consistency means for me as your parent telling you what you need to do?
So I'll start, and then I'd love to hear what Dr. Moffitt has to say. I think it goes back to that collaborative conversation idea I was mentioning before, is that each family, to your point, each family is going to have different rules. And those you can kind of decide together, when do those rules apply and in what ways, right? So if your child's saying to you like, well, in these situations, I don't want to do that, then have a conversation with your child. Well, no. The rule we've decided on as a family still stands, regardless of what situations you're in. And so I think you can actually walk through that. It is incredibly confusing. You're making such a good point. It can be very overwhelming for families, even just to keep track of like, what are the regulations here? What are the rules here? What are we supposed to be doing here? And so again, even writing that all out. Okay, so at school, this is what we're doing. And when you go to soccer practice, this is what we're doing. And when you're commuting in between, this is what we're doing. And you can lay it out really clearly and then talk through with your child. Here's what are the areas of confusion? What are you not sure about? And how do we kind of negotiate to kind of make sure that we're following the safety protocols as you as a family decide make the most sense for you?
Yeah, I would completely agree with what Dr. Lee said. I think it really starts with clear communication as a family upfront, and doing maybe even some of that role playing that Dr. Lee was describing before. So sort of establishing the sort of baseline rules, we're masking when we're indoors with people who aren't part of our household, when we're in a car with people who aren't part of our household, where, the windows are down, whenever the windows can be down, like laying out some of those ground rules. But then maybe using and explaining why those ground rules exist for your family. Again, really bringing it back to what makes your family really your family and special and unique in that way, and makes those ground rules so important. And then you could play out some examples, some role play of exactly what might happen in a day, some of the predictable stuff and maybe even some of the unpredictable stuff. And it would take me back a little bit to when my kids were about to go out and start playing with other kids in the neighborhood, and we sort of had to establish ground rules about what was safe and what wasn't safe, and kind of revisiting some of that framework with your family around COVID. And acknowledging upfront that that things are changing really fast right now, and that you guys are all in this together. And you're doing your best to keep yourselves and others safe.
Great, thank you. I'm going to start to get into some of the questions that have come in to this group. There's an awful lot, so I'll stop monopolizing it with my own questions and start to get to some that are coming in from the audience at home. First is, you've got a lot of people saying that they're scared to bring COVID home. Whether it's a parent that commutes on the train or whatever it is that they're doing, or a kid that's in, there's some preschools that they're not requiring masks and the kids are too young to be vaccinated. What do you say to parents and kids then?
I would start by saying, I would start by saying that it's understandable that everybody would have anxiety around exactly what it's going to take to keep ourselves and our family safe right now. And part of that is it gets to a bit of what the unknown is. Again, though, I would sort of go back to what Dr. Lee recommended in terms of thinking about what you can control rather than what you can't. So if the risk really in terms of being exposed, becoming infected, and bringing the infection into your household exists in the things that you would be doing outside of your household, particularly when you're going to be headed indoors and you're going to be spending time indoors around people outside of your household, wearing a mask for that period of time to reduce your likelihood of becoming infected. A lot of people ask, well, what if I'm wearing a mask, but the people who are sharing space indoors with me are not? Agree, but then you have to kind of fall back again on the things that are within your control and the things that are outside of your control. The studies around transmission and the effectiveness of masks at reducing transmission certainly showed that transmission is reduced even more so when both the infected person and the uninfected person who are in that space together are both wearing well-fitting masks. But certainly the transmission is improved if even the person on the receiving end is wearing a mask, even if the infected person is not. So again, really doing everything you can that's within your control to take those layered strategies. Having yourself vaccinated, if you are eligible for vaccination, will reduce, first of all, the likelihood that you'll become infected at all. But secondly, it will reduce your likelihood of infecting others. We still need more data on this around the Delta strain. There have been some data that have indicated that viral loads are similar, both in vaccinated individuals who get breakthrough infection with the Delta strain and in unvaccinated individuals. But that is not completely clear yet across multiple different settings. That was borne out in one CDC report of an outbreak that occurred here in Massachusetts. But there are other studies suggesting that viral loads are lower in those who are vaccinated who experience breakthrough infection, again, depending on the circumstances around that infection. There also are emerging data that vaccinated individuals who become infected clear the infection from their upper airways more quickly, much more quickly than do unvaccinated individuals. So the duration of time during which a breakthrough case is infective is reduced because of vaccination. So there still is just so many reasons to be vaccinated if you're eligible to be vaccinated, both to protect yourself and to protect those around you. So again, really focusing on the things that you can control when you are returning home, washing your hands really well. I think we learned a lot about really not having to go too crazy with disinfecting the surfaces of everything that we sort of left the house with that day, but making sure that your hands are clean and you did everything that you could while you were in consequences or scenarios where transmission might have occurred to keep yourself safe. That will go a long way towards keeping your family safe as well.
Here's a good question. There's a couple combined where one is asking about why is 3 feet now okay when it used to be 6? And someone else saying, how is my child actually safe to eat in the cafeteria when their masks are off, they're eating. Kids aren't always the cleanest eaters. Thoughts on that?
Yeah, so the 3 feet versus 6 feet, and then I'll come to the cafeteria question. We actually got a relatively well-controlled study near the end of the last school year that was able to evaluate transmission in school settings where they had been able to maintain the 6 feet of distance compared to school settings where 6 feet of distance was really just impossible. But for in-person learning, they were able to at least keep the 3 feet of distance. And when other layered measures were in place, including masking of students and staff, there really was very little difference in transmission. And they also tried to control for community transmission. So it was a fairly convincing study that with other layered measures in place, there really was not a clear benefit to the 6 feet versus 3 feet of distancing. And that made a huge difference in terms of what schools were going to be capable of in getting as many students and staff back into classrooms as possible. To address the eating question, this one comes up a lot. It's completely understandable. Obviously, that would be a higher risk time when people are going to be in a cafeteria eating, and those who are eating will be unmasked. I've seen a lot of different school district approaches to this. And I think where most of them are falling is that they are keeping that time that students are actually at tables and eating, they're keeping that time at a minimum. They are reducing the number of students who are sitting together at tables to try and keep distance as much as possible. This, of course, is going to be variably effective depending on the age of the students and their compliance with this, but they are asking students to keep conversation to a minimum while they're unmasked and while they're eating. And then when possible, they're getting students kind of out of that unmasked cafeteria setting as quickly as possible and transitioning some of that lunchtime into, heading outdoors. Even at ages and in schools where otherwise time outdoors was not a routine part of the daily schedule. So there are things that can be done to still continue to reduce that risk as much as possible. And that's what I've largely seen from schools so far.
Dr. Lee, anything to add?
No, I mean, this is great advice. I think it really goes back to the best way to keep ourselves safe is to do everything we can that's scientifically recommended and backed to keep each other safe. I mean, one thing that that's circling around in my head as I'm hearing about these questions, and also just from my own work and talking to so many families over the last year, is it's so hard to feel that even when we do everything we can't really fully be safe, because that's the nature of COVID, right? But I think sort of recognizing that there's some element of uncertainty here that we can't fully control actually can be very freeing. And not in like, okay, we can't control it, we should just do whatever we want. I think the clear recommendation here is to try to really be safe and follow all these safety protocols. But I think there's something very reassuring if, as a family, you're saying, here's the expert advice, we're doing everything that we can, that's all that we can do, right? And the rest of it is sort of, there's no way to fully say, we're not going to get COVID, we're not going to, spread COVID. There's no way to keep, unless we're living in a bubble, which in some ways we sort of are, unless we're really living in a bubble, there's no full way to get rid of all of that uncertainty. So sort of noticing, okay, uncertainty is a part of life. We're experiencing it at such higher degrees right now and in such a more intense, scary way. But I can't fully control uncertainty or make it entirely go away because it's just a part of life, and even more so during COVID. But what I can do is I can accept that there's some things that are uncertain, and then there are many things that I can make certain. So again, going back to that control thing we've been talking about, what are the things that you can do that are within your control to kind of keep your kids and your family safe? And that's the best that you can do. And knowing that that is just going to be how it is, and that there's an understandable element of anxiety that comes with that. But if you're doing the best that you can, you're doing the best that you can. And I think there's something important to recognize when you're trying your best.
Thank you, Dr. Lee and Dr. Moffitt. Another question, here's one that I thought was interesting. How can kids stay safe in the bathroom in school when they have to flush the toilet and someone in COVID may have been in the stall before them? A lot of surprising amount of bio-related questions.
Yeah, I think, the same principles apply here. So I think the theoretical concern there would be that if someone had gone to the bathroom and, there were then infectious material, is it aerosolized when they flush or something like that? Keeping your mask on for the duration of the time that you're in the bathroom, careful hand hygiene after you have used the restroom would really be the two foundations of safety there.
Great. Another question, I think you've covered this before, but just to reiterate, you said I have my kids take off their clothes in the garage when coming home from school and then showering. Is that overkill? How long will the virus live on their stuff?
Yeah, no, it's maybe overkill. I don't know. I have boys who are sometimes resistant to showers, so maybe it's just a good habit to get everybody into, and you can blame it on COVID. But we did learn a fair amount last year about what's called fomite transmission, which is the likelihood of a pathogen infecting somebody else because they have touched a contaminated surface. And that really just does not seem to be a major player for the SARS-CoV-2 virus. Its ability to survive on surfaces that are of different kind of porous density is really pretty limited. So once it's landed on clothes or something like that, it's really not likely to survive all that long. So I would say, coming home, everyone doing really good hand hygiene, and focusing on those things would probably be the most productive.
Great. A couple of mask gaiter related questions. One, why is a gaiter not as effective as a mask, or why is my school saying it's okay to have a gaiter instead of a mask? And then what types of masks are best for a child that can keep their hand away from their face?
Yeah, no, excellent questions. It's going to be very dependent on the child. The gaiter issue, there was a study last year. As you could imagine, I just want to preface this by saying any studies that claim to, in a lab, have tested the effectiveness of different masks, different face coverings at preventing transmission of SARS-CoV-2 are inherently limited in their ability to really test any of those hypotheses. If you could imagine, there's so many variables. We're not going to use, the real SARS-CoV-2 virus to actually test any of this in a lab setting. And then you try and bring any of those mask-related variables back into your family, the shape of your child's face, the likelihood your child's going to keep any type of a mask on. There was one study, though, that did suggest that for the best they were able to control for different things in a lab setting, there was an increased risk of transmission associated with gaiters compared to either a well-fitting cloth mask or a well-fitting medical grade mask or surgical mask. Again, I think the validity of those studies needs to be taken a bit with a grain of salt, but what is clear is that a well-fitting mask that really fits closely to the face here, covering the nose, coming down, ideally, either coming around the back of the ears or affixing to the back of the head some way, and then coming down and covering under the chin so that you've got full coverage and a good seal around the nose and around the mouth. That's made of at least 2, but preferably 3 layers of fabric. Those consistently are the features of a mask that have been shown to be the most effective. So it really has to do with the fit and the layers. And then I would say beyond that, whatever is going to be characteristic of that mask that will make your child most likely to keep it on is what you should go for.
And how do you tell how many layers a mask has? Is literally you're kind of pulling it apart and looking at it?
Yeah, if you're buying them online, for example, or reading labels, the labels should say, so, I've been buying a lot of masks online, and the labels should be pretty clear about how many layers are in that mask. Otherwise, for some of the cloth masks, if it's not really clear on the label, I've read some things about the sunlight test. I don't know how scientifically accurate that is at predicting a mask's ability, but to stop the transmission of viral particles. But you could imagine if you hold it up to the sunlight and you can see, a dotted pattern of sun coming through that mask, then it probably is porous enough that it's not going to be great at blocking viral particles. But you have to take that on balance with what's comfortable for someone to wear, what they can comfortably breathe in.
Okay. And then there's some questions on long haul COVID. And I know that we have the post-COVID clinic at Boston Children's. When should people be worried that something that they need to have their kids seen for something, what is long haul COVID? When should a parent say, okay, I need my kid to get seen, there's something wrong here? What are those circumstances?
Yeah, so long haul COVID in general, we're learning a lot about it. We certainly have learned a lot more about it in adults than we have in pediatrics, but we're starting to get dribs and drabs of data in pediatrics. We do have a post-COVID clinic run out of our infectious diseases clinic here at Boston Children's that families can absolutely talk to their pediatrician about for referral to. Long haul COVID would be really symptoms that are persisting beyond, 4 weeks to a month after a COVID infection. What it looks like for the most part, and particularly in children, seems to be fatigue, difficulty concentrating, muscle aches, and some shortness of breath, headaches. That sort of constellation of symptoms seem to be the ones that really are predominating so far in terms of long COVID. It does seem that long COVID is occurring much, much less frequently in children post-COVID-19 infection than in adults. And I would say that really any symptoms that your child is experiencing after a COVID-19 infection that really keep them from returning to their baseline level of activity by the time they're about 3 to 4 weeks after infection, you should probably be discussing with your pediatrician.
Great, that's very helpful. And then a couple of quick rapid questions. Can you confirm that the vaccine does not affect fertility?
The vaccine does not affect fertility. We now have data in millions of people who are of childbearing age, who've been vaccinated. There have been no detected signals in the ability of vaccinated individuals compared to unvaccinated individuals to become pregnant. And of course, people are concerned then about how that applies to younger children as well. There is nothing biologically about any of the available vaccines that would suggest that there would be any reason to be concerned about impact on fertility. And that has not been suggested in any of the data available so far.
And what about vaccines for the real little ones? You talked earlier about 5 to 11. What about preschoolers and younger?
Yeah, so, it will take a bit longer. Those studies are also ongoing. Both Moderna and Pfizer have trials going down to 6 months of age. Most of the age brackets are being, the 5 to 11-year-olds, and then the 2 to 5-year-olds, and then the 2 years down to 6 months. So it will sort of follow that order in terms of when things become available. I would expect that it would take at least another probably, 4 to 6 months after we have authorization of a vaccine for 5 to 11-year-olds before we would likely have a similar authorization in those under 5, but the studies are ongoing and well underway.
Just got a few more minutes left. I wanted to give you both an opportunity for any closing remarks, anything that hasn't been asked, that you've been asked in your personal or professional lives that you think is important for families to hear. Why don't we start with you, Dr. Lee?
Thanks for asking. So one of the things that I often get questions about is socialization, right? This is impacting adults too. We're all, look at us all here on Zoom, we're all isolated from each other in these different ways. And obviously, depending on where you live and what your family is able to do, different people have different options. But I think that it's very important to remember that, yes, socialization is important, and your kids getting social activity with their friends, with other kids their age, when they can get it in a safe way, is important. And do not discount the importance of the family interactions they have at home, especially for the little ones. So a lot of times parents are nervous. Well, normally we'd be out, we'd be having play dates. My child would be going to music class. We'd just be out, maybe even at the park and closer to people and able to talk and play on the equipment. And it feels like that's harder to do. And is this going to stunt my child's growth? And even if there's a little bit of a temporary setback, kids will bounce back, especially the little ones. The little ones are the most resilient because their brains are still so new and still forming. And so there's lots of time, and all the social interactions they're having with you at home, the back and forth, the language, the reading, the music, whatever it is that you're doing at home, it all still counts. So don't discount the importance of you all as parents. And then the other thing I always say is, please take care of yourselves. Parents are under so much pressure and stress, and you're having to make these incredibly difficult decisions about what makes sense for your child in terms of their learning and their safety and seeing friends. It's a lot. You need to take care of yourself so you can be there for your kids. So don't forget to do what you need to do for some self-care every day.
Thank you, Dr. Lee. Dr. Moffitt?
Yeah, I think in addition to everything Dr. Lee said, I love the taking care of yourselves point as well. It's so important. But on top of that, I would just say, really talking with your family, talking with your kids, and this can be a bit age dependent, but just about what a great job they're doing and how hard this is for everybody. and that we are in this together. So giving your kids a sense of feeling connected, not just to their family unit, like we're in this together to keep our family safe, but they're in this together to keep their classmates safe, to keep their friends safe, to keep their teachers safe. And in that same vein, really just encouraging that we stay strong in being flexible. We have all been really forced to just make so many changes so quickly in the last year and a half. And there will be not necessarily a clear-cut end to all of this. COVID-19 may well be with us for the duration, but there will be an end to its impact on our lives as we know it now. So that will come. Everything that we're doing right now, including vaccination and other risk mitigation measures, are critical to making that happen and to getting us there. But really just taking a chance to take a breath together as a family with your kids, and people are just doing amazing things to make this all livable.
Thank you. And thank you both so much for your time today and for sharing your extensive knowledge with us. And thank you to all the folks that tuned in. I hope you learned a lot like I did. For more information on anything COVID-19 related for your children, you can visit that section of our website at bostonchildrens.org/COVID-19 or call our dedicated COVID hotline at 855-281-5730. Thank you for joining us.